The next group of terms that I want to go over are directional terms. They indicate a direction of movement or a particular surface or segment of the body. So let's take a look at these terms. I'm going to go over them fairly quickly because I know a lot of them probably are or are familiar with, and this will be a quick review, but feel free to pause and take notes if you prefer. So first off, before we talk about the different movement terms, we need to talk about kind of this concept of anatomic position. Anatomic position tells us what the normal starting point is for the human body. So in order to know what top and bottom is, we have to know how a person normally is positioned. If we think of ourselves as beings that are always laying on our back, then the top of the body would actually be what we think of as the anterior aspect or the front of the body, right? But no, we stand on our feet upright, so we consider the top of the body to be the superior part of the body to be the head, right? So those are important concepts. We also have to think about what position our extremities are in. So anatomic position is sort of this reference point that is used to describe movement. It's sort of that starting point. So it is a person standing upright on their feet. Their feet are flat on the floor, facing toes pointing forward. Arms are at the sides. All of this is pretty simple so far. But then, most importantly, the palms are facing forward, eyes are facing forward, etc. So the palms facing forward is important because you can stand comfortably upright with your palms facing inward, right, or medially. But we've determined that the starting position is the palms facing forward. That means the thumb is on the lateral aspect or the outside of the hand. Its normal position is considered to be lateral, right? And this is going to be the standard frame of reference for anatomical descriptions and the descriptions of movement. So no matter what position I am in, the thumb is always considered to be the lateral aspect of the hand. Even if I supinate my hands and turn them so the palms are facing backward, still the thumb is considered to be lateral because in anatomical position, it's lateral, right? No matter what way I turn my body, my face is always considered to be the anterior aspect of the head. So we need to know this anatomic position because of that. So we have this kind of this reference or starting point. So the first directional term is anterior and posterior. And we're going to see that sometimes different terms are used in different regions of the body. So in general, anterior and posterior can be used throughout the body. Anterior refers to the front of the body, posterior the back of the body. But sometimes we'll see terms like ventral and dorsal used in relation to the axial portion of the body, with ventral relating to anterior and dorsal being the back. I always think of dorsal as the dorsal fin on a shark, so that's the posterior aspect of the shark. And in the hand, we see, for instance, the term volar and dorsal. Volar refers to the anterior aspect or the palm side of the hand, and dorsal is the back side of the hand. Medial and lateral are important terms as well. Medial refers to the portion of the body that faces towards the midline or is closer to the midline. So in example, in the knee, we have a medial collateral ligament that sits over here on the knee. You can see there, and a lateral collateral ligament on the outside of the knee, right? So medial means towards the midline, lateral means facing away from the midline. We can use the same terms for the hand, with the thumb, as I said, being on the lateral aspect of the hand, and the pinky finger, or the fifth digit, being on the medial aspect of the hand. Right? In the hand, sometimes they don't use medial and lateral, they use the term ulnar and radial, because the ulna is on one side of the hand and the radial is on the other. They'll sometimes use that. So since the ulna is on the medial aspect of the forearm, the ulna is often used to say that it's on the ulnar side of the hand, which is the medial aspect, and then radial would be the lateral aspect. And we see the same thing in the lower extremity with the tibia and the fibula. The fibula is on the lateral aspect of the leg, so sometimes they'll use the term fibular, such as naming a ligament, the fibular ligament of the ankle or what have you. So the fibula and tibia also is sometimes used interchangeably with medial and lateral. The terms superior and inferior, we probably already know. Superior refers to the top portion of the body. Inferior relates to the bottom. So, if we're talking about the upper extremity, the superior aspect of the upper extremity would be the shoulder. The inferior aspect of the upper extremity would be the wrist. Even if our hands over our head, we would say that those are the superior and inferior portions because of this anatomical position. Proximal and distal are often used, and proximal means closer to the center of the body. Distal means further from the center of the body. So you could use use them in a sentence to say that the hand is distal to the elbow, meaning that the hand is further away from the center of the body than the elbow. And the shoulder is proximal to the elbow, closer to the center of the body. Superficial and deep is often used to describe the location of different structures. Superficial means more towards the surface. Deep means more towards the center. So, some structures, such as the collateral ligaments of the leg, of the knee, I should say, are found very superficially. They're close to the surface of the body, versus the cruciate ligaments, the anterior and posterior cruciate ligaments, which are in the center of the knee joint, are more deep. For the hand and the foot, they tend to have their own kind of terminology, and I've said some of these already, but often the anterior aspect of the hand is called the palmar surface or the volar surface. The posterior aspect of the hand is often called the dorsal. And we see in the foot, the top of the foot, which is the anterior aspect of the foot, is often called the dorsal aspect. Or superior aspect, and then the inferior surface or posterior surface is often called the plantar surface. It's a little more confusing because in the case of the foot faces downward, right? The plantar surface faces downward, and then the dorsal surface faces upward. Some additional directional terms that you'll see includes contralateral. Contralateral means relating to the opposite side. So if I was to say I move my right arm and my contralateral leg, that means I'm moving my right arm with my left leg. Ipsilateral is sort of the opposite of contralateral. Ipsilateral means on the same side. So if I say to move your right arm and your ipsilateral leg, that would be the right arm and the right leg because they're on the same side. Bilateral means on both sides of the body. So, we often use that in reference to potentially pain. They have pain in bilateral knees, meaning both knees, etc. The final two terms before we move on to an examination of the planes of the body are the term prone and supine. And we often see this in relation to a person lying down or on a table, whether face down or on their back. Prone is when a person is lying face downward. They're laying on their stomach. So this is important when we're describing the starting position for different exercises and so on. Supine is when they're laying on their back, facing upward. So a bench press is obviously done in a supine position. Other exercises are done in a prone position. So this is just that term that can clearly convey the position of a person when they're laying down. Side lying would be the other option, where they're side lying on either the left or the right side.